We all know about public safety. You see police cars and fire engines around. And BCH with 2,200, it's been as high as 2,400 employees, is delivering that and fighting every day to keep people's lives better, fix them. The average citizen doesn't know unless they've been there. You have no idea how much good this institution is doing in the community, and you're paying taxes to the government to provide public safety for you. And you don't know that there's another institution that's doing the same thing, and it's not costing you a thing until you go there.
Having experienced BCH and the system in Boulder, I think that the community hospital system is very powerful. And in some ways, BCH is a canonical example of how it can work. And the idea of that kind of very powerful, impactful, and well-run, well-organized, self-sustaining local organization is a good model for other small cities all across the U.S. There's no question that there's a significant linkage between physical health and mental health, especially at the extremes or in moments of crisis or trauma. And being able to link those two together in the BCH system, I think is very, very powerful and will provide overall much better care for the patients that are either being driven by the mental health issue that's impacting their physical health or a physical health issue that's impacting their mental health.
The mental health aspect is very important to me because for years it was downplayed so much and people would not talk about their mental health issues. Time has changed now where it's okay to mention that you have depression or anxiety or life is hard to cope with. It's much more accepted now.
There's not a family in Boulder who has not dealt with mental health problems with some member of the family. That touches the entire community that BCH deals with from a healthcare delivery point of view. Why should they care? It's because it's universal.
Mental health is a vital part of community health, and when we talk about healthy communities and having Boulder be the healthiest community in the nation, I think the mental health aspect is a vital part of that picture, that we all need to have access to better care and destigmatizing people who need access to mental health care.
It's important, I think, to me now, to try communicating back to the generations the importance and love that's shown by this institution for the people it serves.
It's important to know that you're not alone in dealing with mental health and the incredibly challenging journey that can be for an individual or a family or a community. And I think Boulder Community Health's commitment to really focusing a lot of energy on mental health will really sustain the Boulder community over time.
So many of the hospitals have just done away with their mental health centers. It's so important to have that center, and I feel very proud of Boulder community to continue that.
There's lots of ways for people to engage in something like this. I think it's key to focus on picking a way that engages, that speaks to you, rather than engage in an obligatory way. And whether that's contributing money or contributing time or contributing expertise, energy around it, focus on where you think you can impact it the most, that feeds you, and engage that way.